So I'm gonna be doing the skill Peri care. So I'd wash my hands first, and then I gather my supplies. After I gather my supplies, I knock on the patient's door and ask, "I come in?" They say yes. I check their wristband and I tell them that I'm gonna give them a Peri care today, and if that's okay with them. Okay. Then I do opening procedures. So I pull up their bed, I check for the brakes, close the curtain, and after I'm done with that, I get everything prepared. So I set my barrier to put down my supplies, and then I'd fill up this with water, with warm water. I check with the patient to see if it is okay with their wrist. They say yes. I proceed with the procedure, and so I'd have my 2 cloths. So I put them next to, and I also I put the barrier under them. So I take down their blanket, and then I would put the privacy blanket on top of them. After I'm done putting the privacy on top of them, I'd ask them to roll aside so I could put a barrier under them so I don't stain their bed. Okay, then I'd start by opening their legs and then covering their private part a bit so they're not fully exposed, and then I'd start wiping up to down. So I'd first start cleaning the top of their private, and then I'd start going to one side and then the other side and then down the middle. But each time I do that, I use a different side of the wipe. And then after I'm done with that, I'd do it again. I'd rinse it and I'd repeat that, and then I'd pat dry it. Okay, after I'm done with that, I'd flip them to their side. So I'd ask them to hold on to the side, and then they'd hold on to the rail, and then I'd clean their butt lock. So I'd go up, down, down, up, so I'm not contaminating under there and they don't get an infection. And then I'd work butt cheek to butt cheek, and then I'd go up. Okay, and then I'd clean and rinse them, and then I'd put them back. I'd lay them back down. I'd take out my barrier, and then I take out the privacy blanket. I take off my gloves. Okay, and then I take out my gloves. I pull their blanket back up to cover them, and then I'd put my side rail back up, and I do closing procedures. And then after that, so I open the curtain again, lower the bed, and check the brakes. Give them their collar, ask if they need anything else. No? Okay. So I put gloves back on, put the cloths I used and the barriers in the dirty laundry, and then I'd wash and rinse this and then towel dry it. Okay. Then I'd remove the gloves, wash my hands, and record a report. I don't know if I mentioned I get the patient the call light, but I give the patient the call light and ask if they need anything before I leave. Then I wash my hands, and then I report.